Everybody, welcome. Thank you so much for joining us for this morning's Family Caregiver webinar on the topic of protecting loved ones and yourself through COVID-19. I will introduce our speaker in just a couple of minutes. First, before we get into that, I do want to just stop for a minute and just say that I hope you and your families are all staying safe and healthy. Obviously, this has been a very different last couple of months for us all. And although we anticipated it being a much shorter time that we're at a stay-at-home, it's seeming to continue for several months now. So I just hope you are all doing okay. And again, thank you so much for tuning in this morning, and hopefully you'll learn some information and about some resources that can help you. So a little bit about ElderHelp. Our mission is to provide personalized services and information to help seniors remain independent and live with dignity in their own homes. We have been around for over 46 years supporting seniors in the San Diego community, and during that time we have also supported family caregivers who contact us about resources and support for helping their loved ones as well as themselves. We offer a variety of programs and services to directly support seniors, and then we have our family caregiver support program where this webinar is through. All of our programs are really designed at reducing social isolation, increasing access to healthcare, and improving overall quality of life. So our family caregiver support program offers webinars like this on an almost monthly basis. We also have our online courses that are available for free. We've developed 5 of them now. So if you have any other needs through your family caregiving journey, I really encourage you to check those out. You can find the link on our website, and you can have access to all of those courses by just logging in. So I'm really excited to be joined here with Cherie Scott, who is a nurse that will be speaking on behalf of Champions for Health. This webinar presentation couldn't be done without the Live Well San Diego partnership as well. So I just want to thank Champions for Health and Live Well San Diego, and especially Andrew, who helped set this up, and Cherie, who's going to be doing the presentation for us this morning. So Cherie, I'm gonna hand the baton over to you.
Okay. All right. Well, good morning, everyone. As she said, my name is Cherie Scott, and I'm here to provide you some education on COVID-19. And I'm going to start off by 2 things. Number one, I'm going to first apologize a little bit in advance. I had a little water damage during the rains, and so my house is under construction, and they've decided this morning, of course, they want to do some noisy things. So I'm hiding in my garage, and hopefully it will stay quiet in here. But if I move in the middle, that's why, and I apologize in advance. Just a little bit of background about me. I am retired in 2019 from the Navy Nurse Corps. I was in the Navy for 25 years. I'm now a PhD student studying nursing science and research, and then I'm faculty for several of the nursing colleges in town. So enough about me. Let's talk about COVID-19. And let's see here. We tested this mouse and it worked, so let's hope it still works. Oops, I'm not getting any clicks this time, Carrie, I'm sorry. There we go. All right, so this has been, this has been updated as of May 12th. So the nice thing about Champions for Health is they do update these slides regularly so that we keep the information. As you well know, information regarding COVID-19 is changing so fast, not even day to day, it's almost hour to hour. So that's this presentation, just so you know, is updated as of May 12th. All right, oops. Carrie, I'm not sure what's going on here. There we go, let's try this. There we go. So the coronavirus is, it's actually a virus that's been around for a long time. It's a family of viruses, if you will. And prior to this, it was only known, most people, as a virus that was responsible for the common cold. but it actually has had a few other showings in the world aside from COVID-19. And as many of you now know, it's called corona because of the way it looks microscopically, and it has these spikes all the way around it, and it kind of looks like a crown. Let's see. Nope, no slide advancement. Carrie, do you want to just advance the slides and I can just tell you when I'm ready? That way we can keep cruising. There we go. So, so some of the other common coronaviruses are in the column that's on the left. And then the new or novel coronavirus, COVID-19, is what that means, novel, meaning that it was new and it was not seen before. So, but there has been other COVIDs or other coronaviruses that are responsible for the 2005 outbreak of MERS and the 2012 outbreak of SARS. So again, coronaviruses are not new. It's just that COVID-19 is a new strain. Typically, what happens in MERS and SARS is that the coronavirus that affects animals somehow manages to metamorphosize and is able to then infect humans. Once it gets into a human and then it can pass human to human, that's what causes the problems that you saw with MERS, SARS, and of course now with COVID-19. Next slide. So, so just as I mentioned, the novel coronavirus, it's just that. It's a new coronavirus that was discovered. I think most of us know by now that the first initial patients were found in Wuhan, China. And the initial reports that was thought to be linked to a large seafood or animal market. And there's been some studies that it might have been transmitted from an animal called the pangolin. Next slide. So it is spread by droplet or person-to-person spread by droplet, by respiratory droplets. And this is important to understand because this really does answer that question about why is this 6 feet? Why do we keep talking about physical distancing from each other for 6 feet? Well, the number is not arbitrary and it's not made up. That comes from years of studying viruses, and viruses that are transmitted by droplets have the ability to travel about 6 feet. And that means when someone sneezes, coughs, or even unfortunately when we talk, you know, we actually have microscopic spray that comes out of our mouth, and that droplet can travel about 6 feet. It really can't go any further than that because of gravity. There are other diseases such as tuberculosis that actually travel via airborne because they're smaller particles, and so they can travel farther in the air, but most viruses are respiratory droplets, and COVID-19 is thought to be transmitted by droplets. So that's why we are all abiding by this new 6 feet rule. It also, though, those droplets, when they land in gravity, they can land on surfaces, and it can live on a surface, and we don't really know how long yet. That's being studied, and you know, just like everything else that's being studied, we'll know more in hindsight. Unfortunately, we'll be able to look back, and our scientists are rigorously working on answering these questions. But we do know that it lands on surfaces, and if you touch those surfaces and then you touch your face, namely your eyes, your nose, and your mouth, which has mucous membranes, you can expose yourself to the virus that way as well. Next slide, please. So what are the symptoms that people are reporting? So people are reporting mostly a cough, shortness of breath, and the traditional flu-like symptoms. And what I mean by that is fatigue, muscle pain, chills, fever, that type of thing. Some people are getting a sore throat. They have been large reports, including one of my students who got COVID-19, and I've checked in with her very often via Zoom. And the first thing she had was that loss of taste or smell. She said you'll know it if you feel that. It's pretty outstanding. She said it was a very unusual thing, and that takes weeks to come back, your taste and smell. Of course, this list is not, everyone doesn't have all of these, and some people have nausea, vomiting, and diarrhea. There's been other reports, but this is about the most common. Symptoms tend to appear about 2 to 14 days after exposure. Again, we don't have the exact incubation period, but it is being studied, and we are starting to get some well-known anecdotal evidence because of the numbers. Next slide. So COVID-19 is diagnosed by a DNA or polymerase chain reaction test, and that's done through a nasal swab, and it's a pretty invasive nasal swab. It goes pretty far up into your nose. Current testing sites are available. If you see on here, and I'm sure Carrie's going to provide this slide for you, but you can call by appointment, or you can go online to make an appointment. And then they have drive-up testing as well. It is not required to have a doctor's referral, but please remember, this is a test to see if you had it, not to see if you're exposed. So, but you can go to the drive-up centers, and really this is what San Diego County and the state of California has been working on, is getting many testing sites set up so that people can get tested. If you do not have health insurance, you can call 211 and they will refer you to one of the county websites. You can still get a test even if you don't have health insurance. This is a really important point. Next slide. So there's two kinds of tests. I actually had, my husband and I went and had the antibody test, which is one kind. That's the one that says serology. And then the other column, which says molecular or PCR, that's the actual test for the virus. So the virus test is the one I explained. It's a nose or throat swab, and it's a diagnostic test. It will take several days to get confirmation of whether you have the virus or not. The other test, the serology test, is actually looking for antibodies. So when we get exposed to a virus, our body goes right on the attack. So we have different antibodies that are short term, and then we have some that come in later. And so this antibody test, actually, they just take a little bit of blood from your finger. It's a finger stick, and it takes about 15 minutes to get results. And it will tell you if you have been exposed or already had COVID-19 and now have antibodies. What you have to understand is you wouldn't do this test if you were sick, right? Because that would be the test for the disease. And in fact, when you sign up for the antibody test, which that one is not covered by most insurance, you have to pay cash typically, but it may become more available over time. But they will ask you, and you have to be symptom-free for at least 14 days because they're looking for somebody who has had symptoms, not somebody who has symptoms currently. Next slide. So COVID-19 is really treated mostly by treating symptoms, right? It's supportive care. That's what they mean by supportive. We're making sure we're treating the fever, we're treating the fatigue, we're treating the pain or nausea and vomiting. There has been a lot of medication and anti-immune therapy studies going on, clinical trials. So they use this process called emergency use authorization. And really what that is as a drug company or a drug researcher, if you start showing early promise in a field where there is no other medication, then they can kind of accelerate the use of that medication. However, you know, that still would go on to get randomized clinical trials like we do for all drugs in order to eventually be deemed that this was effective or not effective. People who are not sick enough to be hospitalized, which is the majority of people with COVID-19, you're advised to really stay home, right? You really don't want to go out into the hospital and infect more people, including our essential workforce. But also you don't want to expose yourself to anything else there. So you're really better off to stay home and self-isolate. And we're going to kind of go into different terms, quarantine and isolation, in a little bit. But really what you want to do is pick a room in the house that's just yours, hopefully your own bathroom, and have everyone else steer clear. And you want to do that for 14 days. Next slide, please. So based on the current information and what we know, the risk factors for who is at highest risk for getting COVID-19 is older adults, people 65 years or older, although we are, you know, in San Diego, that they're actually the least amount of numbers of people getting it. They're just at more risk because when they have it, it tends to be more severe and it tends to be more fatal. Obviously, anyone living in a nursing home or a long-term facility, and this is again because of that close contact that we have and those droplets are able to spread. And then anyone with underlying medical conditions. So people, especially with lung disease or heart disease, asthma, severe obesity, and any sort of immunocompromised state are really at risk when they get COVID-19. Next slide, please. So who should be tested? Well, obviously the most important people to be tested is our patients that are hospitalized, so we can make sure that we're treating them for the right thing, right? Any symptomatic healthcare worker. So my best friend is a travel nurse. She's currently in Idaho, and she called me this weekend and said she wasn't feeling well. She had a sore throat, sound like laryngitis. She lost her voice. Didn't sound like COVID, but she had to go get tested, right? Because I can't have her out taking care of patients if she's positive. She was negative, by the way, but she still has to stay home, just like you should when you get a cold, so you don't give it to your patients. But she's not at risk for spreading COVID-19. So that those people that are identified through the public health investigations, high risk settings, homeless shelters, our correctional facilities, that's the top priority for testing. And then I won't read you the list, but you'll see as it goes down, symptomatic persons, and then third line would be symptomatic persons that are in essential occupations, and then finally community testing. And I've been teaching this class now for about 5 weeks, and 5 weeks ago really it was only priority ones is all we had enough tests for. So you can see in such a short period of time how things have already gotten better, and we're already beginning and able to test more people. Next slide. So what can you do? Well, obviously the best thing you can do is to prevent yourself from getting sick and avoid being exposed to the virus, right? The more all of us stay healthy and do not overrun the healthcare system, the sooner we give time for those that are sick to be treated, and the more time we give our scientists and our medical researchers adequate time to hopefully find a really good treatment and or a vaccine. So the San Diego Public Health Order, which can be found at ca.gov/COVID-19, but you can review the public health order. I think most of us are starting to become quite familiar with it. And really what it is, it says stay at home as much as possible. And that if you go out, you should go out only for essential things, and you should practice social distancing, or what I like to call physical distancing. I think social distancing kind of has a bad rap, right? We're such social creatures as humans, but really what they mean is physical distancing. We should remain that 6 feet apart so those droplets can't make their way over to me from 6 feet away. You want to wash your hands, and that should be vigorous friction, getting all in between the fingers, the fingernails, right? Vigorous friction for at least 20 seconds. And if you've not ever timed yourself washing your hands, 20 seconds is a lot longer than you think. So get used to singing happy birthday twice. If you're using alcohol-based hand sanitizer, make sure you rub it till it's dry. And that's how that works. Then you want to avoid touching your mouth, nose, and eyes, right? The zone. And I will tell you, as a teacher and as a student and being on Zoom and webinars all the time, I have started to see how often I touch my face. So it is very helpful to be on camera so that you don't do it that often. You want to clean and disinfect things, avoid people that are sick. If you have to sneeze or cough, you should really do that into a tissue. And if you can't or don't have time, into the crick of your elbow, not your hand, because then you're going to go touch something. And then, of course, the public health order does call for the wearing of face masks in order to prevent the virus. And I know this has been quite controversial because, first they said do and then they said don't. And really, the purpose, and we're going to go into it a little bit more, but really the purpose of the face mask and the county order is that we don't know how long you are passing the virus when you are first sick and you don't even know you're sick. And so it's to help prevent us from passing it to everyone else if we don't even know we're sick yet. Next slide. So everyone needs to stay at home. This list, I will not read it to you, but really what it's talking about is essential businesses, which obviously, banking, food, gas stations, that type of thing. And then our essential workers, right? So we've got to have our public works. God bless our waste management officials, our law enforcement. And then we're just now starting to see the reopening of several other businesses. Next slide. So face coverings are required, as we talked about already, and I gave you the rationale. And like I said, I do understand that there's a lot of confusion in the community about why do I need to do this and why not. But that is the science behind why they've decided to go with wearing of the face mask. It's for that that 2 to 14 day period where you could be passing the virus and not even know it. Some recreation sites are starting to open. So for example, you can go to the beach. However, the boardwalk is closed, but you can. I have gone running this last week on the beach. It did feel good to get some fresh air and get my exercise in so that I can stay healthy. There are certain parks open. I do know that tonight the board is voting on the reopening plan. So stay tuned for more information that should be coming out after they send that off to the governor. And they're supposed to be voting on that tonight. So that will be a lot to do with what businesses will be open, which ones are doing curbside pickup, and if other things will continue to reopen safely. Next slide. So I've touched a lot on physical distancing, or what is often referred to as social distancing. And really, again, the whole point of this is to minimize the passing of those droplets, right? So they really would like you to stay, the county would like you to stay really within your own household. And it should really just be those essential people. If you have to come in contact with someone, it's really important that you try to stay 6 feet away. I've got all these construction workers at my house. They all are wearing masks, and we stay 6 feet away from them. And if I'm going to have to be within 6 feet, then we both need to be putting on a mask. Next slide. So this is a great slide. It's got some links actually that talk about the cloth face coverings. And this does come from the CDC. And you'll notice it says it now requires. And the reason they use that word now is because this really did start off with no, you shouldn't, yes, you should, kind of going back and forth. And so I think there's been a lot of confusion. But the new recommendations were based on studies that show that the virus, that there has been people with COVID-19 that have tested positive that had no symptoms whatsoever. And so unfortunately, they can then pass it to somebody in the community who may not fare so well. So that is the logic behind the face covering. But that doesn't negate washing of your hands. The other thing I've seen with the face coverings, and I'm just going to give you 2 nurse pieces of advice. The face mask needs to cover both your nose and your mouth. If you're wearing it down here, it's not doing its job. And I know that it can be if you're not used to it, it can be stifling, it can be hot. I'm not only a nurse, so I'm used to wearing one, but I was also in the military. So after you've been in like a gas mask for 8 hours, a surgical mask doesn't seem that bad. But for those that aren't used to it, it does take some getting used to. But it really does need to cover both your nose and your mouth in order to be effective. The other thing is you really got to try not to keep touching it, right? Remember, this is the zone that we're trying to steer clear of getting anything brought into that we have touched, brought into our body. So when we start touching the mask, really what we're doing is we're kind of cross-contaminating ourselves. So really want to put the mask on and then try to just leave it alone. Next slide, please. There we go. So like I said before, we'll go over some terms. I think we all have been using these terms, and we may not always use them correctly. You'll notice that I always say COVID-19. I don't refer to it as the coronavirus because I know that coronavirus means a lot of things. And right now, what I'm talking to you about is specifically COVID-19. Well, quarantine and isolation and shelter in place orders and physical distancing, those are all terms that often are used interchangeably but aren't. So a quarantine person, that is someone who is healthy, but they've been exposed, right? So let's say, for example, I'm healthy, but my husband is sick. Then I need to be quarantined for 14 days because it's that period of time where I could be carrying it, but I don't know yet, and I don't want to pass that to somebody else. Once you're sick, then it's called isolation, right? And we isolate people in healthcare for all sorts of things, not just COVID-19. If you get shingles and you're in the hospital, you'd be on isolation, tuberculosis patients, and so on. Next slide. So the public health order, as we all know, that fancy term, right, to flatten our curve. And if you take a look on the San Diego website, I actually was exploring the up-to-date data yesterday. They've got some great graphs, very easy to follow and read. And you can see our curve is quite flat in San Diego. In fact, the state of California really never reached a peak. We with the stay-at-home order, we were able to just kind of keep that curve, and let's hope that it stays that way or just goes down. Next slide. So again, listen, this isn't the time for international travels. I'm supposed to be in Italy in July. Don't think that's going to happen. So right now, the CDC is recommending only essential travel. No leisure travel, and you really shouldn't even be leaving the county if you can help it. This way, each area is not kind of cross-contaminating the other areas. But yeah, you certainly want to make sure. And the airlines have been really good. I've gotten all the travel that I have, and there was quite a few trips that I was supposed to be on. They all have been fully refunded. I'm waiting for my Italy refund right now. So the airlines have been quite good. I just took credits because this will eventually pass, and I will go to Italy. So I'll take that credit. Next slide. So what should you do if you think you have COVID-19? Like I was talking about with my best friend this weekend, right? So the first thing she needs to do is stay at home and separate herself from other people. And then I had her make a telephone call to her doctor. You're really better off, unless you are having difficulty breathing or you're really having some issues that require emergency attention. The best thing you can do is do a telehealth and just call your doctor. And they will give you the medical advice over the phone. They may ask you to go to one of the testing tents to get tested, one of the drive-throughs, so that you're not going in and infecting other people. But even for some people that are just mildly ill, as like my student, they didn't even have her get tested. She just was better off staying at home. It was very obvious that's what she had. She had all of the classic symptoms, and she recovered just fine at home. So you'll want to make sure that if you are sick, you definitely should not be around anyone. If you have to be, definitely you both need to wear face masks, wash your hands, and clean all your areas. But really, you should just be trying to self-isolate for that full 14 days. Next slide. So in San Diego County, like I said, you really should go to this website, the coronavirus-sd.com. It's got some great information. It helps clarify the stay-at-home order, which I think you'll really want to be watching this week, because there are going to be some changes as we progress into this reopening. And I think that there's some likelihood that we may reopen certain things and kind of fluctuate back and forth based on data. And then 4:30 p.m. every day, there is a daily San Diego briefing in addition to the state briefing, which is at noon every day. Next slide. So just to recap, and perfect, it's 10:30, we're right on time. So just to recap, COVID-19 is the virus that has now become a pandemic spreading around the world. The best way to prevent getting sick is to avoid being exposed, right? So it's to stay 6 feet away from people and really practice that physical distancing. This is a great time to reinvigorate our hand washing practices that I hope stay. I'm a nurse, so I hope this pattern of not coming to work sick stays. I hope the pattern of us having good hand washing stays. But I do hope that hugging comes back one day, because I do miss hugging people. But the testing is expanding, and especially in San Diego and in the state of California. And you really should just be engaged and staying in touch with what's going on in the county, so that you can help you and your loved ones stay safe. Next slide. So here's some resources. Again, I'm sure Carrie will share this slideshow with you so that you can have all of these links, these great phone numbers, and these great resources. Next slide. All right, now I'm available for questions. If you'd like to ask a question, please feel free to go ahead and I know that I breezed through that. I wanted to keep it at 30 minutes for you, but I'm happy to take any questions.
And just a reminder for those of you who are wanting to submit questions, you can do that through the raising of your hand function, and we'll read those out. Cherie, thank you so much. That was a wealth of information, and I was glad to hear some updated things as well. So I appreciate that. We did have one question come in about any recommendations for cleaning face masks.
Oh, great. Yes. So if you're going to be using the cloth face masks, then you can just go ahead and wash them with your laundry. And for mine, when I do my sheets in the bed, most modern dryers actually have a sanitize button, which means it just uses high heat. And so when I dry my face masks, I use the sanitize button. If you don't have a sanitize button or you have an older dryer, then just after you wash it in hot water, then dry it in high heat. It's better than hanging it to dry. That high heat works very well. If you're using a surgical mask, unfortunately, those cannot be cleaned as well. So eventually you'll have to throw them away. But you can, in the meantime, clean them off with a antibacterial cleansing, but they tend to disintegrate pretty fast if they are the paper surgical mask.
Very good, thank you. And we have a very nice compliment coming through for you, Cherie, that you offered a very personalized and professional presentation and not just reading the slides. So thank you.
Thank you so much. That was very kind. This is after leaving the military, all my friends are deployed right now in support, and a lot of my nurse friends are at the bedside. And so this is one of the few ways I can give back to the community. So it is my pleasure, and I just appreciate everyone's time.
Very good. And I will be sharing the PowerPoint with all of you who attended. So I will send that out shortly with the recorded version of this webinar. Let's see if we have any other questions coming in. Just thank you for your service.
Thanks.
That's to you, Cherie.
Thank you.
Any other questions? All right, we're gonna go through, I think you have one more slide here.
Okay.
Oh, it's a thank you.
Yep, that's the feedback form. So if anybody wants to fill that out and give the Champions for Health a feedback, I'm sure they would appreciate it.
Wonderful. And I'm just going to finish up with a couple of slides here, but thank you so much, Cherie. It was a pleasure having you on this webinar. And again, you shared such great information, so we really appreciate it.
Thanks,
for those
Carrie.
of you who are tuning in, we do have an upcoming webinar. So save the date for Tuesday, June 16th at 11 o'clock. The topic will be maintaining your brain health, and we'll have a speaker from Alzheimer's San Diego join us for that. I am going to leave up ElderHelp's contact information. If you, for some reason, don't get the email that I send out with the PowerPoint and with the recorded version, please feel free to reach out to us, and I would be happy to send that to you. So thank you all so much for joining, and I will stay on for a couple more minutes if anybody has any questions. And Cherie, thank you again so much for your time this morning.